Welcome to Mercy Medical Center's live webinar. Today we will be discussing home care services. Joining us is Margie Pence, Director of Mercy Home Care Services. After her discussion, she will take questions from our audience. To submit your questions anytime during the discussion, go to the window in the upper right-hand corner of your screen and type in your question. If you don't see the screen, click on the orange box with the white arrow. Your questions will be confidential. Well, welcome to the webinar, Margie. I'm going to turn the mic over to you now so we can go ahead and get started.
Thank you, Lynn. Well, all of us who work in the home care industry know that November is recognized as National Home Care Month. So this is a wonderful opportunity to heighten awareness of the benefits of home care. As we get started, I just want to review today's webinar objectives. First, what is home care and who can benefit? Secondly, why are home care services growing? And finally, how can I access Mercy Home Care Services? I believe a great way to explain home care and all the benefits is to cite examples of patients who have received our services. I've changed names and a few other identification pieces, but know that this will tell the story and offer a picture of home care. So our first patient is Josie. Josie is a very busy 36-year-old woman. She's the mother of 3 young children. And Josie suffered an accidental injury to her knee that actually spread to the bone. This infection is osteomyelitis, and the only way to treat it is with intravenous antibiotics. Not too many years ago, this treatment would have necessitated a hospital admission for many weeks because it was not even considered an option to treat in the home. Well, we received a referral phone call from Josie's physician with orders to begin the IV antibiotic treatment in her home. Josie first went to the hospital on an outpatient basis to have a special IV line placed that served as the route for the infusion therapy. Next, our infusion company delivered the drugs and equipment to Josie's home. That same day, our nurse went to Josie's home and instructed her in the step-by-step process to actually self-administer the IV medication. We went back the next day just to make certain that Josie felt comfortable with the procedure. And then we followed up with weekly visits to monitor her wound and change the IV site dressing. So throughout the 6-week course of treatment, Josie was able to be home with her young family and continue in her important role as a wife and mother. Our next story is an 82-year-old gentleman named John. He was treated in the hospital after suffering a stroke. Once he was medically stable, John and his family were very motivated to have him return home to continue his rehabilitation. Our nurse met with John and his family while he was still in the hospital to explain the home care services available and clarify with them what is covered by Medicare. The day after John returned home, our nurse made a home visit and completed the full assessment that was shared with other members of the home care team. A very important step in that visit was a review of the discharge medication list and educating John and his wife in the purpose of all of those medications. We find that patients and families are so much more relaxed and able to remember this important information when we can sit with them in the comfortable surroundings of their own kitchen table. The nurse also offered guidance in skin care and bowel and bladder function. Our physical therapy team guided John in safely moving about his home with the use of his cane. We also developed a home exercise program that John performed twice daily. We identified he was weak, and our focus was to increase his endurance with the goal that he would be able to safely leave home once our therapy was completed. Next, our occupational therapy made a visit and offered advice on equipment that would allow John to safely shower independently. One of our home health aides made a visit 3 times a week to assist John with his shower until he fully regained his strength. Probably the greatest impact of John's stroke was how it affected his ability to speak and communicate. As you might expect, this was extremely frustrating for John. Our speech therapist met with John and his wife for several weeks, and he made some wonderful progress. It's normal to take a while for speech to improve after an individual suffers a stroke. So in all, Mercy Home Care Services cared for John for 5 weeks. He reached his optimal level of independent functioning and is now safe in his home. Our next patient is Martha. And Martha is 78 years old, and she lives with her husband, Bill. She was hospitalized to treat a sudden onset of shortness of breath accompanied by swelling in her abdomen and ankles. The doctors told Martha she had congestive heart failure, and that caught her attention. She was worried, and she wanted to do all she could to stay healthy and avoid further hospital admissions. Martha requested Mercy Home Care when the hospital discharge planners told her the doctor ordered home care services. The nurse visited Martha the day after her discharge from the hospital, and once again, that all-important piece of medication review took place. There are many times a home care agency can clarify and reinforce the education that patients receive during their hospital stay. The nurse taught Martha what symptoms to watch for and when she should call her doctor. Even though Martha met with dietitians in the hospital, she was very receptive to a dietitian home visit to review all of those key points with regard to limiting salt in her diet. We have another important piece of home care technology is home telemonitoring. Martha's doctor agreed this would clearly benefit Martha and catch any of her problems that might develop early on. So we installed the telemonitor device in her home the day after she returned home. And Martha was taught how to use this technology every morning. It actually monitored her blood pressure, pulse, the oxygen level in her blood, and her weight. And all of this vital data is electronically sent to our home care office for a registered nurse to review, and it's easily accessed by her cardiology office every day. So if Martha's vital signs were out of the physician-ordered guidelines that the physician set, then the nurse at Mercy Home Care receives an alert. And we follow that alert with an immediate phone call to Martha. Further steps may be to call the doctor, or the home care nurse make a visit, or have her stop into her doctor's office. We have found that this technology has made a tremendous impact on our ability to help patients stay home after a hospital stay and even avoid emergency room visits. Martha was a great student. We discharged her from home care services after 4 weeks, and by that time she understood the purpose of her medications. She took them faithfully as ordered by her doctor, and she had gone out and purchased her own blood pressure machine and scale and monitored those vitals every single day. So if you're needing to find a home care agency, I want to just go through some important questions to ask as you're selecting a home care agency. First of all, does that agency offer the specific services that I need? As we talked about a couple of those cases, do they have infusion therapy? Do they have physical therapy and all of those rehab therapists if that's what the patient condition warrants? Another very important piece is staff availability on weekends, nights, 24 hours a day. It might be just for a patient or family to call with a question, or it may be that the nurse would actually need to go out to the patient's home and assess what's the condition of the patient and offer suggestions. Also, does the home care agency inform the patient and family what their insurance will cover and what, if any, out-of-pocket expense you may incur? Another important question is the agency accredited by the Joint Commission, and is it Medicare certified? Those are important quality initiatives that consumers can rest assured that the agency is meeting all of the regulatory expectations. A couple other websites that might be of help is the Medicare Compare website and then the mercycare.org website. At Medicare Compare, you can actually go to the home care piece and then enter in your zip code, and you would be able to find all of the home care agencies that are providing service in that area. You'd also be able to find some of their clinical outcomes and how they compare with other agencies in that surrounding area. The Mercy Care website gives a really complete explanation of all of the services that we offer at Mercy Home Care. Another important piece in the healthcare industry now is patient satisfaction. All home care agencies that are reimbursed by Medicare are required now to send their patients a satisfaction survey. We submit our survey is done by an independent organization, and this ensures that the patient's responses are kept totally anonymous. What these surveys do is home care providers are compared to other providers in the service area across the state and nationally. And there's a lot of important questions that are captured in the survey. Were the staff friendly? Did they arrive on time? Would you recommend them to your family and friends? And were they responsive to your needs? Mercy Home Care, we are very, very pleased with the outstanding survey results we have achieved. This graph is a pictorial of our patient satisfaction measures. You can see the blue column are the survey results from October 2010 till September 2011, and then the orange column are the patient satisfaction results throughout the year in 2011. The dotted line is the average Iowa score, and the solid top line is the national top 20% of home care agencies. So you can see in all of these 5 areas, Mercy Home Care has done better than the Iowa average and very close to the national top 20 in the areas of care being provided in a professional manner, the home care team communication, whether that's between the clinicians or communicating with the patient and family, making sure that the medications, pain, and home safety were clearly discussed. And the question, on a scale of 1 to 10, would you rate your agency at a 9 or a 10? You can see we've achieved some very top scores there. And then finally, would you definitely recommend the home health agency? As I meet with my peers throughout the state, all of us are saying, boy, we're busy. We are so much busier now. We're admitting more and more patients. And as we think about that, there's multiple reasons why home care is growing. First and foremost, patients prefer to be at home. We know, we see it every day, that patients heal and recuperate better in the comfort of their own home, when they can sleep in their own bed, sit in their own recliner, and provides an ease of stress. We also know in this day and age that there's shorter hospital lengths of stay, and we are able to continue the patient's recuperation and rehabilitation very nicely in their home. Another important piece is that people are living longer with chronic illnesses. And by our team of healthcare professionals, we are able to educate people and empower them to better manage these chronic illnesses and remain safely at home. So, how would a person go about accessing Mercy Home Care? We do need a physician order, but all you would need to do is call us and explain your situation, and if the physician hasn't ordered, we'd be happy to call the doctor's office and get the order. The patient has to have a skilled need for Medicare and commercial insurance to pay for it. What that means is that it requires the skill or the help of a registered nurse or a rehab therapist. So all of those scenarios today where a patient had a new diagnosis and they needed education, and we needed to closely monitor their vital signs, and we continued their rehabilitation at home, those are all identified as skilled need. Sometimes patients have a need. They might need assistance with homemaking, they might need assistance with personal care, but if there's not the skilled need, then Medicare and those insurance companies wouldn't pay for the home care. Our patients are served wherever they call home, and it might be for a while that they go home to a family member's house. We still, of course, can provide home care. It's wherever they're residing. Currently, we serve patients in a 40-mile radius of Cedar Rapids. And finally, if you have any questions, you can call us at 319-398-6034.
Well, thank you, Margie. To remind our listeners, your questions can be submitted from the box in the upper right-hand corner of your screen. And we'll take a look at our questions here. So, first question we have today, Margie, does insurance always cover home care?
If the situation is such that, like we spoke of today, if the patient has a skilled need, most insurances do cover home care. There's we've encountered very few insurances that would not cover home care, but certainly Medicare, Medicaid, and most insurances. And we would check that, get all of that confirmed prior to admitting the patient.
Our next question is related. Is there a difference in coverage between my commercial insurance and Medicare?
For the most part, no. Commercial insurances may require that we communicate with them periodically throughout the course of care and update them on the patient's progress toward goals, and then they would approve further visits. But those criteria that they hold us accountable to are very much the same as the criteria that Medicare expects. So I would say that there really isn't a big difference. other than we might need to communicate with the different insurance companies throughout the course of care.
Okay, it's good to know. Next question, is there a maximum amount of time I can qualify for home care? And then what is the average length of care?
The maximum amount of time a person can qualify really is determined by several criteria. One of them is that the patient needs to be homebound. And the way that we interpret that is if the patient leaves the home, it's on an infrequent basis and it is a taxing effort. So they still may be able to, it's okay for them to go to the doctor, certainly, to go to church, maybe go to the beauty shop, but it's infrequent. And when they do come home, they find that, boy, that trip really took a lot out of me. The second piece is that you need to, of course, continue to have that skilled need. So it really varies, the maximum amount of time really varies patient to patient and their progress toward goals. Sometimes a patient, for example, a patient who's had a total joint replacement, they first receive their post-hospitalization care at home, and then after about 3 weeks, they've progressed very nicely, and it'll be good for them to go out to an outpatient therapy session to further improve their mobility. And actually, it offers some better strengthening opportunities. So the average length that a patient is with us at Mercy Home Care is maybe 30 to 45 days. Again, varies on each patient's situation.
Okay, next question here, Margie. My husband will soon be discharged from the hospital after surgery, and I'm nervous about responsibilities managing his care. Can you offer me any help with this worry, which I would imagine is pretty common for the caregiver?
You are right, Lynn, that it can be kind of an overwhelming thought to think that a family member is taking their loved one home after being so sick in the hospital. So we can be there the day they go home or the day after to, again, we go through each piece in that discharge instruction sheet and really coach them through all of the steps that they need to be able to be safe in their home. I think one of the key pieces that I've stressed throughout this webinar today is the importance of that medication management. Another piece is that we are only a phone call away. So they can, should something come up that maybe they didn't quite capture everything that we told them, because people are almost bombarded with information while they're in the hospital, and then on those first few visits, they can just pick up the phone and call us, and we can certainly clarify. I can tell you that it's amazing what families can do and how they can really provide exceptional care to patients in their homes, and they probably never even imagined that they'd be able to provide that. But again, with the proper education and coaching by our team, we've seen many, many successes.
That is reassuring to know. Our next webinar topic is colorectal cancer with Dr. Vincent Reed. This webinar will be Thursday, December 13th from noon until 1. And again, he will take your questions live after his discussion. Now, a tape of this program will be available at www.mercycare.org/live and within the next day or two. And then you can always check this website for information about future webinars and listen to past webinars. I believe we have covered all the questions submitted to us, but if you have additional concerns or questions, Margie can be reached at the number on your screen, 319-398-6034. Thank you for joining us today.